Do you ever feel like your skin is burning, or your eyes are stinging for no clear reason? What if a rash spreads fast and starts peeling like a bad sunburn? That could be a rare but serious condition called Stevens-Johnson syndrome, SJS, also known as type 4 hypersensitivity. It's not common, but when it happens, it acts quickly and can become dangerous. Imagine your body attacking its own skin and mucous membranes because of a mistake in how it reacted to medicine. That's what SJS is like. It's not just a rash, it's a medical emergency. So if you or someone you know had a fever, blisters, and a spreading rash after starting a new medicine, don't wait. This is your body sending a red alert. Most of the time, it's a reaction to medicines. Let's say you started a new pill for seizures like carbamazepine, or an antibiotic like sulfamethoxazole. Your body might mistakenly treat the drug like a dangerous invader. Instead of fighting germs, your immune system goes after your own skin and inner linings. It's like setting off a smoke alarm because of toast, but this time the response is way too strong and damages your body. Some infections like herpes or mycoplasma can also trigger SJS. And here's something interesting. Some people have a gene HLA-B1502 that makes them more likely to get SJS from certain drugs. So if you're of Southeast Asian descent and your doctor wants to prescribe carbamazepine, a simple genetic test might save your life. So how do you know if it's SJS and not just a mild allergy? Well, it usually starts with flu-like symptoms, fever, headache, sore throat. Then, within 1 to 3 days, you might notice a red or purple rash that spreads fast, especially on the face and trunk. Now here's the scary part. The skin starts peeling off in sheets, like burned skin. Your eyes might feel like they're full of sand. Your mouth, lips, and even private areas can get painful sores. Imagine trying to drink water, but your mouth is full of blisters. That's how painful it can get. And the scary thing, it can look like a burn injury, but you didn't touch anything hot. If more than 10% of the skin is affected, it's SJS. More than 30% is toxic epidermal necrolysis TEN, a more severe form. Time is skin. No single test can instantly say you have SJS, but doctors look at your symptoms, medicine history, and may take a small skin sample, called a biopsy, to check under a microscope. Think of it like a detective checking clues. What medicine did you start? When did the rash begin? How fast is it spreading? Once confirmed, treatment happens in a hospital, often in a burn or intensive care unit. The first step, stop the drug that caused it, if one was responsible. Then, supportive care, IV fluids, pain control, wound care, and protection from infection. It's like treating a severe burn without the fire. Antibiotics are used only if there's infection, not to prevent it. And yes, eye specialists often get involved because long-term vision damage is a real risk if the eyes are affected. Can you stop SJS before it starts? Yes, by being proactive. Always tell your doctor about any bad reactions to medicines in the past. If a medicine makes you break out in rash or feel very sick, speak up. Genetic screening before starting certain drugs, like carbamazepine for people with Asian ancestry, can catch high-risk cases early. Also, never share prescription medicines. What works for someone else might harm you. Think of it like wearing a seatbelt. You hope you won't need it, but it protects you just in case. Educating patients and doctors about the early signs of SJS is also key. Early action saves lives. Science is making progress. Researchers are exploring how immune cells called T cells cause the skin damage in SJS. New studies are testing drugs that might calm down the immune system early in the disease, like intravenous immunoglobulin, IVIG, or biological agents. There's also work on better genetic testing to predict who's at risk before giving certain medicines. Some hospitals now use AI tools to scan patient records and flag high-risk drug gene combinations automatically. It's like having an extra pair of eyes to stop SJS before it starts. While there's no miracle cure yet, these advances are turning SJS from a sudden shock into something